Hi, my name is Jada Milan, and this is my signature assignment on epilepsy. So, what is epilepsy? Epilepsy is a disorder that causes nerve cell activity in the brain to be disturbed, which eventually results in unprovoked reoccurring seizures. So, this diagnosis is typically generalized, meaning there's no specific origin reason why the seizure is happening. It's typically a generalized diagnosis that means reoccurring seizures. And obviously, they're able sometimes to be traced back to genetics, which means, the seizures run in the family. It could be due to a prior brain trauma, an autoimmune disorder, birth defect, metabolic issues, or even an infectious disease. And obviously, each case of epilepsy varies from person to person, but most people have no identifiable cause. And then some demographics behind epilepsy. It can basically develop in any person at any age. It's more common in really young children and then adults later in their life. Some statistics is 1 in 26 people will develop epilepsy in their lifetime. It's the fourth most common neurological disorder in the world. And to kind of break it down to the US alone, there's 3.4 million people living with seizures. And for some reason, no apparent reason, it's more common in men than women. Some anatomy behind epilepsy. So epilepsy typically affects specific regions of the brain. So depending on which symptoms you have will help diagnose which region of the brain the seizure is occurring in. So for example, if you're having bodily sensations, kind of like that numbness, tingling, they're going to want to look in your parietal lobe. If you're having a hard time processing vision, they're going to want to look in the occipital lobe. And then the temporal lobe, that's going to affect the hearing, speech, and memories, emotions. But more commonly, seizure activity is found in the hippocampus, amygdala, the frontal cortex, temporal cortex, and olfactory cortex. And then, like I said, depending on what motor function or senses are affected, will help determine which region of the brain is misfiring or the seizure is occurring. And then some physiology and anatomy. Those with epilepsy may experience abnormal sensations, behaviors, kind of whole body fatigue. They might lose consciousness, and then obviously seizures are the main symptom. For muscular, they're going to have muscle contractions. They may experience spasms, pins and needle feeling, kind of like that numbness, tingling. Some other common symptoms would be amnesia, anxiety, depression, headache, or even staring spells. And then obviously for your grand mal or clonic tonic seizure, that's going to look like the jerking movements, the eyes rolling back, stiffening of the body, and then even trouble breathing, loss of consciousness, and then sometimes loss of bladder or bowel. This is due to the body relaxing after the seizure, so it's common to lose your continence. And then it is said that epileptic people typically have a normal life expectancy. Obviously, this varies from person to person and the severity of their epilepsy and the frequency of their seizures, but most people with epilepsy live a long, normal, healthy life. And then diagnosis and treatment. So how is epilepsy diagnosed? Epilepsy is typically diagnosed with a test called an EEG. And then what that looks like is this image I have right here. It's electrodes connected to the brain, and then it kind of measures the activity and electrical activity in the brain, and will help show doctors where the seizures are occurring. So even if you're not having seizures, an EEG will still show which regions of the brain are affected. And then obviously neurologists are going to want to do a motor tests. They're going to want to test your mental function. They're going to do blood tests, genetic testing, and then for a better picture, they're going to want to get an MRI, CT, or even a PET scan. And then for treatment, most commonly, they're going to prescribe anticonvulsants, which are going to help prevent convulsions, also known as seizures. They're going to want to recommend a ketogenic diet, which is going to help inflammation in the brain and the body, and then even therapy, and then sometimes surgery if they know exactly where the seizure is occurring or the misfire is happening. They can go in and fix it that way. And then the seizure medication, the anticonvulsants, typically cause some side effects, which are going to be fatigue, dizziness, weight gain, memory issues, speech problems, irritability, or depression. And then, unfortunately, epilepsy is a reoccurring condition, but it has the potential to go into remission. Remission basically means a long time period of freedom from seizures. But as long as you do the correct regimen and you take your meds and you're consistent with all the things doctors recommend, that is more likely to happen. And then for my last slide, these are my references. Thank you so much for listening. This purple ribbon is for November, which is Epilepsy Awareness Month. So thank you so much for listening.